First of all, I want to make it perfectly clear that I really had nothing to do with starting the free clinic. But the free clinic was Trice Gravitt's idea. When the word got out that he needed volunteers for his free clinic, I was right in there from the very first day.
I got a call from Trice one afternoon, and he said, let's get together for a couple of beers, and that wasn't that much out of the ordinary. However, the last thing he said was, "I'm buying," so you knew something was up.
During that time period, I was in conversation with people at the health department, and I said, "What's a need here?" And they said, "Not only do we need kids' health care here, we have unmet needs for the community." So in conversation with the health department and people that knew about this Planning District 9 study, I said, well, shucks, why can't we have a free clinic?
So the free clinic, like many of them around the state, started with physicians volunteering, nurses volunteering, other staff volunteering in off hours, and some small amount of resource supported that. And the good news, at least in Fauquier County, is I think you've had more volunteers to help. You got a group that can adapt, probably more easily to adapt and meet the need through an organization like this sometimes than through the more structured payment-driven organizations.
The clinic is here to be a safety net for those that don't have an opportunity to get the same medical and dental care that those that have insurance or those that have the wherewithal to afford it. We provide that.
The free clinic is so essential, I'll be honest. There's so many patients out there who just cannot afford dental care and medical care. But, working in the dental department from a dental perspective, it's really sad how a lot of these patients wait till all of their, they've lost a lot of their teeth. So I think it's amazing. It's amazing in the sense that we can take care of their needs and at the same time break bad cycles. So we're able to take care of parents, try to educate them about how to take care of their kids, and just get everybody on the right track.
The patients we see here are actually the patients we would love to take care of even in private practice. They're really good patients. They want to do well by their health, and that's very rewarding for us and for them. And we get continuity here, which is nice. We see them every 3 months. We see them improve. We've got patients here that we've had for 10 years, 15 years. So it's more than just medicine and medical care. I think we've all kind of had our share of going outside the medical box just to try and help them in some special way.
It is an incredibly valuable resource for the community. We have the ability to get people ongoing health care that they just wouldn't be able to get in any other way. I refer people to the clinic on a daily basis. It's a very important resource for me personally to get my job done well.
What is special about this clinic that serves Fauquier and Rappahannock? Not just Fauquier. It's not a Warrenton clinic. It's a community clinic. Is that word the community? Our employees work in this community. Their children are here, their families and friends. This is our community. So the answer to the question is this great place that we live.
When I first came there, I was seeing patients in an examination room, stirrups, toilet, all of that. And that was a big adjustment for me. But the people were so grateful to be seeing anyone. Now that we have a larger space, we also have contracted with psychiatry, so we need medication. And the patients are getting it. So they're also being treated on 2 different levels, psychiatrically and psychologically.
Fauquier Free Clinic over here, they have a nice communication. Everybody same like that. How you doing your mother-in-law, and how doing my new medicine, and how you doing my wife. They talking look like family. asking, any problem, please don't be late. And sometimes they medicine not ready, they say come Thursday, late afternoon when you coming from work, pick up medicine, refill, whatever. They're so nice.
The patients are so appreciative of what we do. We've had some that will go out and bring something back. I've had people tell me that they have left the county, Fauquier or Rappahannock. They have gone other places. They cannot get the same care that they get in other counties. So they move back to the county to come back and get in the system and start receiving the care that they had before.
I think back about the early days of the clinic. We were desperate for more room. That's what I remember most of all. It seemed to me I was seeing patients out in the hallway and out in the parking lot. And that's what I remember most, and we were so greatly relieved when the day came that we moved into our new facility.
Knowing what it was like when it first started in a little tiny place, and now the community has gotten, and the hospital have gotten behind it and supported it, and we have a really nice facility here that we can provide many services for. I didn't realize when I first came here to volunteer what advancements they had made in the facility. It's wonderful. I was surprised at what high quality.
Our new facility provides us a lot of opportunity to collaborate, and so a big movement in the healthcare field is like healthcare teams. So our medical providers are collaborating with the mental health providers and the dental providers. We can do it all together, so it's like one-stop shopping for the patients. Some patients just do not want to leave here when they're no longer eligible. They love the services. They love our providers.
A person is one of many parts of themselves: the brain, the emotions, the dental, the teeth, and then their physical self. And you can't treat one of those without treating any of them. You have to do that because it's the only way you can reach the complete person.
I think the uniqueness of our free clinic, it first starts at it's a community free clinic. I think it's something that you accomplish, first of all, you accomplish it so successfully because it's a community-based effort. Everybody in the area knew about the free clinic, and that's what made it successful. It wasn't just the healthcare providers that volunteered their time, it was everybody else that got it, that saw the need, and they kicked in their resources, and there were some great benefactors, that helped us grow out the product from there.
Rob has done an outstanding job of getting the right people in for the right job and getting the grants that we need. And I mean, we've just come so far, just the 10 years I've been here. And I just hope we have another 25 years.